So I posted a short about my son who got diagnosed with hemophilia, which is a rare blood disorder. And I had a lot of questions. To be honest, I was not expecting the video to blow up. So today I'm going to cover some basic questions about hemophilia. And then I'm going to cover a couple of other things as well that I saw in my comments. So first, what exactly is hemophilia? So I'm just going to talk about it in a really general sense, and then I can get more specific. So first, hemophilia is a blood disorder, and it's very rare. My son has a low factor IX percentage. So in normal people who don't have hemophilia, their blood percentage of factor IX is 50 to 100%. That is how your body clots. So if you hurt yourself, you twist your ankle, you bleed, right? Your body naturally will heal itself. Well, my son's body does not have enough factor in it. It only has it at 1%. So his is very low. So what happens when we have individuals with hemophilia is that their bodies do not clot correctly. And I will show some pictures and things like that so you can get a visual as well. So he is considered a moderate hemophilia because he is at 1%. Moderate is 1 to 5%. And then if you have severe hemophilia, you are less than 1%. How do they find this out? So one of the biggest factors of finding out if you have hemophilia is if it runs in your family. Most cases happen because it is a gene that your mother has. A lot of the times, women will carry the recessive gene, meaning that they don't have any signs or symptoms of hemophilia. But then when they have a son, their son can get hemophilia. So how do people get hemophilia where it doesn't run in families? So let's talk a little bit about what happens. So you're pregnant with your baby, and of course, if you carry that recessive gene or even that gene, then your baby can have hemophilia or still may not have hemophilia. Now, somebody in my comments left an interesting comment that said, this is why we need to pay attention to what we're putting in our baby's bodies. The baby is born with hemophilia. There's nothing that I was putting inside my son's body while I am pregnant with him. I actually was very healthy during my pregnancy. I didn't drink. I took my prenatals. I was healthy. I already had a toddler. So at that point in my life, I was going to bed early and taking care of myself. And I was finally getting back into working out. My husband and I were finally reconnecting, and I got pregnant with my son. So that's kind of how that happened. But yes, I was very healthy during my pregnancy. And from reading multiple studies, there is nothing that you can specifically do to stop hemophilia. There's no correlation between anything. So even though you have a really healthy pregnancy, it can still happen, especially if you have a family history of hemophilia. You cannot catch hemophilia from somebody. So you have an intimate relationship with somebody, you're not going to catch it. Which of course we don't ever want to happen, but you mix your blood with someone else's blood, you also again cannot get hemophilia. It is only something you are born with. So let's talk a little bit of what are the chances a baby will have hemophilia. And I actually have information here because I am not a doctor. I am almost a graduate of trauma-focused counseling, but again, not a doctor. The hemophilia gene is carried on the X chromosome. A man with hemophilia passes the hemophilia gene to all of his daughters, but not to his sons. His daughters are called carriers because they carry the hemophilia gene. When a carrier has a baby, there is 1 in 2 chance that she will pass on the hemophilia gene. If she passes the hemophilia gene to a son, he will have hemophilia. If she passes the hemophilia gene to a daughter, she will be a carrier like her mother. Sometimes a baby is born with hemophilia, although his mother is not a carrier. This is because the factor or gene changed only in the baby's body. 1 in 3 babies born with hemophilia have no family history of it at all. Sometimes you won't even have any family history, 1 in 3 babies that are born with hemophilia. So it's important to also get tested. So as far as I know, and my husband knows, nobody in either side of our family have ever had hemophilia. So I go get tested this month in April to see if I have the recessive gene. It is very important for me to find out. Now, let's say I go get tested and I don't have the gene. I just happen to have a really rare situation where my son got hemophilia without any family history. There is new gene therapy I just saw, I believe 2019, I'd have to put it on the screen, that was approved by FDA for adults. It's $3.5 million. One study that I read said that within 15 years, they are going to recheck the people that they tried the gene therapy with to make sure that their factor stayed where it needed to be. So hopefully by time my son is only 11 months, hopefully by time he's older, it's more accessible, and maybe even to teenagers or preteens. That would be amazing. So let's talk about some common signs and symptoms of hemophilia. In hemophilia, bleeding can happen anywhere in the body. Sometimes it can be seen and sometimes it cannot. Bleeding can happen after an injury or surgery. It also can happen for no reason. This is called spontaneous bleeding. Bleeding is rare in babies with hemophilia, but they may bleed for a long time after circumcision. When babies start to walk, they bruise easily. They also bleed longer than usual after an injury, especially to the mouth and tongue. As children grow, spontaneous bleeding comes to be more common. It affects the joints and muscles. So some things to note is that is true. My baby did not ever display any spontaneous bleeding. Now, I did talk to some mamas in my hemophilia group who their babies did have bloody mouths, or they get lots of bloody noses, and my son did not display any of those. The only symptom my son displayed was bruising, and it is extreme bruising. It is protruding from the skin. It is hard, it is purple, and it is big. So let's say he falls to the side and hits his arm, he will have a huge bruise, okay? So that's one thing that caused me to realize this is not normal. And having a toddler and another child already, I knew to have bruising that bad and it lasting as long as it did was not normal. So she would fall here and there, right? Toddlers fall, and she'd get bruising. Within a day or two, her bruise would lighten up and it would be gone within like 4 or 5 days. My son would fall and the bruise would all of a sudden start small. Then it would be this huge, massive bruising. And then it would protrude from the skin and have like little lumps underneath. And sometimes it could take weeks for that one bruise to heal on him. And that's really where I started to decide there's something going on. Another symptom I had noticed is his sleeping. And I think this has a lot to do with maybe some internal things, but he seems like he's in pain a lot. I would say there are many nights still he is up every 2 hours crying, thrashing, and the hard part is our doctors say to just give him Tylenol, but I don't want to give him Tylenol every day. I don't think that's healthy. So my husband and I take turns both going in and comforting him, offering water, trying to be there, just letting him know it's okay. So that was one thing I did notice is he had such a hard time sleeping and it seems like he was in pain a lot. Hemophilia can cause joint bleeds. So if you watch any of my little shorts that I have, I show that I put knee pads on my son. And we recently started putting elbow pads on him as well. In one of my videos, he has quite a bit of bruising on his arm. So we decided to start doing elbow pads as well. And he will be that child at the park that has knee pads and elbow pads. And that's okay, right? Because we have to protect. The important thing to remember too is even though we are giving my son treatment and injections, his blood does not clot like it should. So we still have to be really cautious. We don't want to make more pain and more problems for him. So what happens if my son gets a joint bleed? A person with hemophilia knows when a bleed starts because the joints feel tingly and warm. So the joint swells and becomes painful and hard to move. Without treatment, the pressure from the swelling eventually stops the bleed. Later, special cells clear most of the blood out of the joint. When people did not know about hemophilia or before they had treatment, we saw people in crutches or in wheelchairs because they did not develop correctly because of all those joint bleeds. So right now that he is a toddler, obviously, if he hurts himself, he does not understand to rest and take time. A lot of the moms I talk to, we do extra treatments 2 to 3 times a week as they're growing. We also want to make sure if he does have internal bleeding, he gets treatment. Once they get older and they are more aware of their bodies, let's say my son is 7 or 8 and he twists his knee or he hits it and he might say, Mom, my knee hurts. I think I'm going to rest it. I might have a joint bleed. At that time, even if we're doing treatments 1 time a week, we'll probably give him an extra treatment just to be cautious and to make sure that everything is going to go okay, because we have to be really cautious of the joint bleeds. And to be honest, as a mom, that's the hardest part about all of this is knowing that he has to take care of his body and I have to really let go of that control. Obviously, as a parent, I want my children to, be in control of their decisions in their life because they're eventually going to be adults. But the hardest part is when it can really affect his life, his development, and his joints. He has to be really cautious, but I also don't want him to ever feel he can't have any fun, and I never want to take away his joy. That's just my hardest part with the joint bleeds and him being cautious. They have hemophilia camps that my son can go to. So at camp, he can be around other kids and they can give them more information, and it'll be great for him to connect with other people who have similar disabilities as him. Most joint bleeds happen in ankles, knees, and elbows. So that's why we have to make sure we protect his knees and his elbows. And of course, his ankles. He twisted his ankle a while ago, or it could have been because he had a joint bleed at the time we didn't know he had hemophilia. So I'm hoping, as far as we know, he is still walking on it, but there was a second time again he was not using it. We just have to be more cautious, and as he's growing up, that ankle might be a little bit more sensitive than his other one. There is another treatment that he can have. So if he twists his ankle and he's already taking factor injections, I heard there's an oral medication that he can take as well to help every 6 hours. Another thing to keep in mind is if your child has hemophilia and they hit their head, we are told we have to take him to the hospital as soon as possible. If we don't already have the factor injection at home, then we need to tell the hospital he needs a factor injection as soon as possible and a CT scan. And the book that I am reading, Raising a Child with Hemophilia, has been huge. There's a section in there that says we cannot just wait in the waiting room for hours if our son hits his head because he could die. So we have to be very forceful in the waiting room and say, my son has a bleeding condition. If he does not get his factor, he will die. So on another note, my husband and I are going to try to figure out how we can get factor sent to our house. So that way, if something like that happens, we can bring the factor to the hospital with us if my son is not old enough to inject himself, and they can give him the factor, and then we can push for the CT scan to make sure that he does not have internal bleeding. So who can get Hemophilia B? Hemophilia B is a genetic disorder that is typically inherited. It is caused by mutation in the gene that provides instructions for making clotting factor. As a result, the condition is more commonly found in males than in females. And then overall, hemophilia B is a relatively rare disorder, affecting approximately 1 in 25,000 to 30,000 males worldwide. It is important for individuals with a family history of hemophilia B to undergo genetic testing and counseling to assess the risk of inheriting the condition and to make informed decisions about family planning. So as my son grows older and he finds someone, they will decide together if they find it appropriate to have children. So what is replacement therapy? It is an injection into the veins. You don't want to do the same vein every single time, else it can hurt your veins. So another option, a lot of moms, as their babies are young, they get ports, and it's like a little button, they say, and that way I can inject my son 2 to 3 times a week in that little port instead of having to take him to the doctor. Or sometimes you can get a nurse to come to your house, and that way he can get his medication right away. Or let's say he slips and falls, I can give him an extra factor treatment at home and not have to be worried about getting somewhere quickly, so they can give him a factor treatment. So there's just a lot that goes into that as well. The biggest question I had that I could not find answers online is, how often? So usually what happens is once they know your factor percentage, you go in and they will give them a treatment. And then you have to wait usually 2 to 3 hours to make sure that your baby does not have any symptoms or signs of it not working or any type of reaction. And then depending on you're using like a prolonged injection, they have you come back after 7 days and they test his blood again to see what his factor percentage is, to see how long his body takes to metabolize that injection. So they do have prolonged factors. Talking to some moms, their son will have it work for 6 days. Some moms is 7, some moms is 8. I have yet to talk to somebody who has it last the full 10 days. It says 7 to 10 days. So that just depends on your child. So there's a lot of things that go into it. And then talking to the specialist, she said sometimes you want to do 2 to 3 times a week regardless because they're growing and we want to ensure there's no internal damage in their joints, especially with development. Okay, so why are bleeds serious or life-threatening? Bleeding within the head is a major cause of death in hemophilia, especially in children. Head bleeds can cause headache, nausea, vomiting, sleeplessness, confusion, clumsiness, weakness, fits, and loss of consciousness. Bleeding in the throat may result from infection, injury, dental injections, or surgery. Throat bleeds cause swelling, as well as difficulty swallowing and breathing. Major loss of blood is life-threatening. It is uncommon in hemophilia except after an injury or when related to another medical condition. Other bleeds may be serious, but usually not life-threatening, such as bleed in the eyes, spleen, and muscle. Blood in the urine is common in severe hemophilia, but rarely dangerous. Why should bleeds be treated quickly? When treatment is late, the bleed takes longer to heal and more treatment product is needed. How can bleeds be treated with first aid? So you use the RICE acronym, rest, ice, compression, elevation. And again, when they're little babies, this isn't realistic, but once my son gets older, he can learn more about RICE and how to take care of his joints. So how can bleeds be treated with factor replacement? Hemophilia can usually be treated by injecting the missing clotting factor into a vein. Clotting factor cannot be given by mouth. Clotting factor can be found in various treatment products. The possible side effects of a product should always be considered before using it. People with mild hemophilia or another condition called von Willebrand disease can be treated with a medicine. It can be given by injection into a vein, injection under the skin, or a nasal spray. Repeated treatment is usually needed. What treatment can help? Other treatments may help, such as pain medication, anti-inflammatory medication to reduce swelling, a different dose or schedule of factor replacement, and repeated doses of factor. So a physical therapist can suggest ways to strengthen muscles and restore joint movement, say if it is safe to return to normal activities, and prevent further injury. So my son will have a physical therapist he works with, and we will also have a social worker that we are in constant communication with as well. I think I covered the most basic information of questions I still had when I first found out. Hopefully this video is informative. So I want to talk about, I had a question on here. Why would you share this information about your son? So a couple things. When I first found this out, I was on YouTube and there was no videos on hemophilia B. So I was looking through videos. There's one on hemophilia A, and I just couldn't find anything really other than like very informative videos, nothing personal. So I got on TikTok and I found that there was some moms on there who had sons with hemophilia. I reached out to a couple of them. One messaged me back and we kind of, sent messages a little bit. And it just is nice to be able to see that somebody else is living with this and we aren't alone. One mom makes like little TikToks about the medication, what they go through. She had posted a video of them getting the factor in the mail because most pharmacies will not carry it. So I didn't even think about that because my son has not yet started treatment. We are seeing a child specialist in May, so we have to wait for that. Seeing her make that video made me realize, okay, so this is something else I have to consider. She went on vacation and they brought their factor with them, but they had to go to a hospital to get their son injected. And so this was something else I needed to be made aware of, like, oh, if we go out of town and we don't have that port and my son needs his factor for treatment, we will have to find like a hospital or somewhere where they can inject his treatment. So these are all things that, are good to know for information. And again, finding that piece that you can connect with. Now, when I first had started this channel, I am a survivor of domestic violence. I was in a physical and emotional abusive relationship for 6 years. I got out of it and I became a school teacher. And during that time, I was getting my graduate in trauma-focused counseling. So I had started this channel with hopes to talk about mental health. I also am certified in yoga and specifically trauma-focused yoga as well. So mindfulness and breathing is really important for healing of trauma and even a coping mechanism for PTSD. So that was another perspective I wanted to take. I am a mother to 2 beautiful children, so I wanted to talk about being a mother and breastfeeding and everything that goes along with that, and my experience as a teacher working with adolescents, and now my experience going getting into the mental health field. Once I started my channel, if you look at my very first shorts, they were all specifically mental health. And I would say a week or two of starting this channel, I found out my son had hemophilia. And I thought to myself, okay, so this is supposed to be a mental health channel. I am a mother. Maybe I should share my journey of finding healing and sharing this rare disorder. There is nothing wrong with bringing information about different things, even if you know nothing about them. So let's say one day you watch my video and you're like, oh, her son wears elbow and knee pads because he has a blood disorder, but he looks normal. Like, you wouldn't assume he has a blood disorder. And let's say you're at the park and your child or someone says, oh, that kid over there has, knee pads and elbow pads and a helmet. I wonder what's going on. You could always say, maybe there's something internal going on, not specifically a blood disorder, but maybe there's something else going on that we don't know of. So I think by bringing more information and awareness, it makes people understand that there are things out there that we don't always know of. Obviously, most of us have heard of like blood diseases and things like that, but they're rare. So you never think, oh, that's going to happen to me, or I should know about that, because it's not something you're specifically going to look up on a Tuesday afternoon. Hopefully that also can bring in more awareness of disabilities. And hopefully this also helps people see that we all have our own struggles, and how we get past those takes time for everybody. And on that note, I hope this video answered some general questions you had about hemophilia or why I'm on here sharing my story. If you would like to be a part of my journey, I would love that. Thank you so much for watching this video.